I'm Andrea, office manager here at Dunn Orthodontics. Today you got your expander, and I'm going to talk a little bit about how to take care of it and what to expect the first couple days. So the first thing let's talk about is what to expect the first couple days. The expander itself shouldn't hurt, although it's going to feel a little bit strange to have this up towards the roof of your mouth. A lot of patients will experience a lot of saliva production the first couple days, or kids will say, I feel like I can't swallow, or it's difficult to swallow. These are all very common things. Usually within 48 hours, everybody gets used to it. One tip that I picked up over the years is actually drinking with a straw. Helps just kind of figure out where your tongue's supposed to go when you're trying to swallow. So that's a great tip you can try if that's something your child is experiencing. Another thing is it's just a little bit weird to talk. The expander sits up near the roof of the mouth, so the tongue's got to figure out how to articulate around it. Reading books out loud is a great way to get used to it faster. Kind of the more you talk with it in and the more you kind of just get used to it, the quicker you'll feel like things go back to normal. Now, the expander. Biggest thing is staying away from certain foods. Anything that's really hard or really sticky can cause the expander to break or come loose. So really sticky things are going to be Skittles, taffy, Tootsie Rolls. Gum is okay as long as it's sugar-free, so kind of use your best discretion on that one. We absolutely want to stay away from popcorn with an expander on. The little hulls of the kernels that can get stuck in between your teeth and in between your gums can get stuck underneath the expander, and sometimes you don't even know that they're up there until they've caused an infection and the gum tissue gets really puffy. So please stay away from popcorn with the expander on. And then again, things that are really hard. Apples, carrots, fruits, vegetables, slice those into smaller pieces. Anything that's really hard or super crunchy, having smaller bites, or maybe just avoid altogether. Now, cleaning the expander. Generally, you're just going to want to brush it. Toothbrush, toothpaste, brush all around the expander up towards the roof of the mouth. If you ever feel like something gets stuck on top of your expander, we do provide you with a small syringe. You place it into water, fill up the tube, and then you can actually take the tip and put it up above the expander and help spray or irrigate to help get any food down. If you ever notice that the roof of the mouth, the gum tissue is looking a little irritated around the expander, as it does sit close to the roof of the mouth, you can actually put a little bit of mouthwash in with the water just to dilute it, but actually spray that up there too to help with any irritation of the gum tissue. The next part of the video here is we are going to actually show you how to be doing these turns at home. Now it's time to do your first turn at home. You've been provided with an expander key. You're going to turn the key. I like mine to be at about 90 degrees. You're going to have your child lay down so their head is positioned up. Think about how they would lay in a dental chair and how the doctor would position behind them. I think it's easiest to actually come from upside down. So having them lay off of a bed or their head up off the arm of a couch to kind of put them in this propped up position. Now, right on the expander, you're going to see a hole right when you look in the mouth. The notched part of this key is going to go into that hole, almost at a downward angle. There are arrows on your expander that are actually going to show you the direction to turn it in. What you'll do then, get the notch of the key in and push down, almost swinging like a pendulum. You'll know you've turned it completely when you can't turn it any farther. The good thing is there's a bar back here. You cannot overturn the expander, but you can underturn it. What you want to see is that there's a new hole visible right at the top. If you go to do the turn the next day and the hole's not there, it means it hasn't been completed all the way, and you would actually move back in the back of the mouth and come at an upward angle to find the hole and continue the turn completely. Basically, what's on the center here is a small cylinder with 3 holes on it, and you're working through a rotation, turning it little by little by little until we've achieved the expansion. Generally, Dr. Dunn is going to have you turn the expander 1 time a day. So again, place the notched part at a downward angle into the hole, swing it like a pendulum all the way down until you can't push it any further, and then let the key drop out down towards the tongue. Generally, we're looking for 28 turns on the expander, but please follow the instructions given at the appointment by Dr. Dunn on the written sheet inside of your expander bag.